The Health Watch right now with Dr. Syed Hussain from Trinity Health of New England. Here in June, it is Men's Health Month. We want to start by talking about some topics that are related to men's health. Good to see you again, sir.
Likewise.
We've talked a lot about melanoma. Of course, in the summer, it's an important thing to do. I was not aware that it looks like men apparently are disproportionately predisposed to getting melanoma, especially after the age of 50. What do we know about that and why that's the case?
Yeah, that's true, Tim. So the risk of men dying from melanoma actually goes up exponentially as they grow older, from 50 to all the way to age 85. And there are a couple of reasons behind this. We know, and this is data based on surveys, that women tend to take care more of their skin. They're more aware of sunscreen lotions. They apply those lotions as opposed to men. But there's also a genetic component here too, where men have more elastin, less fat cells in their skin, which basically means it's firmer, it's tighter, and which predisposes the skin to more damage from UV rays from sun. So what men need to do, especially now during these summer months, is wear a hat if you're outdoors, wear sunglasses, use sunscreen lotion. There's sunscreen lotion now being made for men. SPF of 30 or above is what is recommended to protect your skin, as well as covering, if possible, any exposed skin. And using shade if possible.
Of course. You know what? I hate to say it. I almost feel like it's a little refreshing to find out that there is a genetic component to it, because so many times men's health problems, when they're disproportionately affected by something, it kind of boils down to men are just dumb when it comes to taking care of themselves. They don't want to help themselves. They don't want to go to a doctor, and it happens. And it looks like that is at least one part of that. All right, moving on. There was a U.S. government report that found that people in the LGBTQ plus community are more likely to have serious mental health problems. They're more likely to misuse drugs and alcohol. What can we do to try to stop that trend from getting worse?
Yeah, this is a large report that was released based on data from 21 and 22 by the Department of Health and Human Services, Tim, which indicates higher rates of suicide thoughts, depression, anxiety, mental health conditions in general, along with substance use. And some of the triggers include stress, minority stress, discrimination, and stigma. So all things that policymakers need to take into account when we're dealing with minority populations in terms of screening, in terms of access to care that is targeted towards this community so they feel welcome.
Yeah, so many of the problems seem to stem from stigma too. Mentioned alcohol, don't want to demonize it. There was a good study from the American College of Cardiology suggesting light to moderate alcohol consumption could help reduce stress, which in turn could help the heart. This just seems like the latest back and forth. This is one of those topics where the latest study says alcohol is bad for you, then it says it's good for you. In reality, they're never claiming something that absolute, but it's an interesting little wrinkle here.
Yes, it's a large study looking at 50,000 patients at Mass General, and they looked at people who had light to moderate drinking, not heavy drinking.
Light to moderate.
Basically, we know that there may be some cardioprotective or heart protective effects of light to moderate alcohol, but it seems there may be more here at play, including how the brain sends signals to the rest of the body in terms of stress, in terms of, okay, this is good, this is bad, and some of that may be linked to the brain not sending any stressors to the heart, which in turn is protective.
Do you know how they define light to moderate?
They have not. They haven't commented on that, but it's a
less
fine
than what
line.
drinkers
That's
want.
right. That's right. Exactly.
I'm guessing it's not 3 drinks a day would be considered light.
Right.
Also, by the way, I love how ever the doctor, you were quiet when I started saying men are stupid about taking care of themselves. Those are my words, definitely not his. Very, very smart. Doctor, thank you for taking the time to join us.
Thanks, Tim.
Dr. Syed Hussain from Trinity Health in New England. Not only is he a font of knowledge, he's a font of patience, too. He puts up with a lot.